If you are over 70 and your knees have been aching after your daily walk, you are not alone. So many people in their 70s and 80s come to their doctors saying the same thing. I thought walking was supposed to be good for me, so why do my knees hurt more than ever? It is one of the most common concerns among older adults, and honestly, it is a very fair question. Walking has always been praised as the perfect exercise, simple, free, and gentle on the body. But here is something that might surprise you. For some people, especially those with knee discomfort or changes in their joint cartilage that come with age, certain types of walking routines may actually be putting more strain on the knees than they realize. Today, we're going to talk about what orthopedic specialists, that is, doctors who focus on bones, joints, and muscles, often share with their patients about protecting the knees as we get older. And we are going to look at some simple, gentle exercises you can do right at home, even from a chair, that may help support your knee health without putting extra pressure on those precious joints. Before we go any further, I want to share a quick but important note. Everything we discuss today is for educational purposes only. It is not a replacement for personal medical advice. Every body is different, and your own healthcare provider knows your health history best. Please always consult your doctor or a qualified health professional before starting any new exercise routine, especially if you are managing a health condition. Now, let us talk about what is actually happening inside your knees as you age. Your knees are remarkable joints. They carry your entire body weight with every step you take. Inside each knee, there is a cushioning material called cartilage. Think of it like a soft, rubbery padding that sits between the bones and helps absorb shock. When we are young, this cartilage tends to be thick, smooth, and full of fluid. But as the decades pass, that padding can begin to thin out. It may become less smooth, and when that happens, the knee joint loses some of its natural shock absorption. Now, here is where walking becomes a more complicated conversation than most people expect. Walking itself is not the enemy. Let us be very clear about that. For many older adults, walking remains a wonderful, health-supporting activity. But the type of walking, the surface you walk on, the distance, and the condition of your knees can all make a significant difference in whether walking is helping you or quietly adding to your discomfort. Orthopedic specialists often point out that long walks on hard surfaces, like pavement or concrete, can place repeated impact on knees that may already be experiencing some cartilage wear. Every step on a hard surface sends a small shock wave up through the foot, into the ankle, and straight into the knee joint. Over the course of a 30 or 45-minute walk, that adds up to thousands of repetitive impacts. For someone whose knees are in excellent condition, this is usually no problem. But for someone dealing with stiffness, tenderness, or early joint changes, that repeated impact can contribute to soreness and inflammation over time. This does not mean you need to stop moving. Quite the opposite. Movement is absolutely essential for joint health. What many orthopedic professionals suggest instead is shifting the focus from high-repetition impact walking to low-impact strengthening exercises. Movements that help build the muscles around the knee without sending shock waves through the joint itself. You see, the muscles around your knee, particularly the quadriceps at the front of the thigh and the hamstrings at the back, act like natural braces for your knee joint. When these muscles are strong, they share the load. They take pressure off the joint itself and help keep everything stable and aligned. When these muscles are weak, the knee has to work harder, and that is often when people start to notice more pain and discomfort. The good news is that building strength in these muscles does not require a gym membership or heavy equipment. It does not even require you to stand up if standing is difficult for you. Some of the most effective exercises for knee support can be done sitting comfortably in a sturdy chair right in your own home. Let me walk you through two gentle exercises that orthopedic therapists often recommend for older adults looking to support their knee health. The first one is called a seated leg raise, and it is wonderfully simple. Sit up straight in a firm chair with both feet flat on the floor. Make sure you are comfortable and your back is supported. Now, slowly straighten one leg out in front of you, lifting your foot off the floor until your leg is as straight as you can comfortably make it. Hold that position for just a moment. You might count slowly to 5, and then gently lower your foot back down to the floor. That is one repetition. Try doing this 8 to 10 times on one leg, then switch to the other side. What makes this exercise so valuable is that it activates your quadriceps, those large muscles at the front of your thigh, without putting any bending pressure on your knee joint. You are strengthening the very muscles that support and protect the knee, all while sitting safely in a chair. If you feel any pain while doing this, please stop and speak with your doctor. But many people find this movement very manageable and even refreshing. The second exercise is called a seated heel slide or a seated knee bend, and it works the muscles at the back of the thigh, which are just as important as the ones in the front. Again, sit in your sturdy chair with feet flat on the floor. This time, slowly slide one foot back along the floor, bending your knee gently as your foot moves toward the chair legs. Go only as far as is comfortable for you. There is no need to push into any discomfort. Hold for a moment, then slowly slide your foot back to the starting position. Repeat this 8 to 10 times and then switch legs. This gentle bending and extending motion helps to keep the knee joint mobile, encourages circulation in the area, and activates the hamstring muscles at the back of the thigh. Over time, with consistent practice, exercises like these may help improve joint stability, reduce stiffness, and make everyday movements like standing up from a chair or climbing stairs feel a little easier. Now, you might be wondering, what about walking altogether? Should I give it up? The answer, in most cases, is no. Many orthopedic specialists would encourage older adults to continue walking if they enjoy it and tolerate it well, but perhaps with some thoughtful adjustments. Shorter walks rather than very long ones. Softer surfaces like grass or a rubberized track rather than pavement. Supportive footwear that cushions each step. And always listening to what your body is telling you. If your knees are consistently sore after walking, that is a message worth bringing to your doctor. It is also worth mentioning that maintaining a healthy weight, where appropriate, can meaningfully support knee health. Research has consistently shown that even a modest reduction in body weight may help reduce the load placed on knee joints during everyday movement. Again, your healthcare provider is your best guide when it comes to any changes in diet or activity level. There is one more thing I want to share with you today, and it is something I think is genuinely encouraging. It is never too late to begin strengthening the muscles that support your joints. Studies have shown that older adults who engage in regular, gentle strengthening exercises can improve their muscle function, their balance, and their overall comfort in movement, even well into their 80s. Your body has a remarkable ability to respond to care and attention, no matter your age. So if your knees have been bothering you, please do not simply accept that pain as an inevitable part of getting older. Speak with your doctor or an orthopedic specialist. Ask about physical therapy. Try these gentle seated exercises if your doctor approves, and pay attention to how your body responds. You deserve to move comfortably. You deserve to stay active and engaged in life, and with the right kind of movement that works with your body rather than against it, that is absolutely possible. To summarize what we have talked about today, walking is a wonderful activity for many older adults, but for those experiencing knee discomfort or cartilage changes, Long walks on hard surfaces may be contributing to strain rather than relief. Low-impact strengthening exercises like seated leg raises and seated knee bends may help build the muscles that protect and support the knee joint, offering a gentler path to staying strong and mobile. Always consult your doctor before starting something new and listen to your body every step of the way. If you found today's video helpful, we would love it if you subscribe to Prime Daily Health so you never miss an episode. And please, share your experiences in the comments below. Have you tried any seated exercises? Have you noticed changes in how your knees feel with different types of movement? Your story might be exactly what someone else needs to hear today. Take good care of yourself, and we will see you in the next video.